Are you searching for a church to call home or a ministry to get involved with? Welcome to Ministry Connections. I'm Evangelist Patrick Hoban, your host and the local ministry director here at AM 980 The Mission. Each week we introduce you to a local church or ministry that is making an impact here in the Twin Cities. Now you can listen to past programs on our YouTube and Facebook channels. Just look for 980 The Mission. Now today we have a well-known person here on KKMS and other radio stations. Her name is Twila Brase of Citizens Council for Health Freedom. Twila, welcome to the program.
It's great to be here. Thank you, Patrick.
Well, everybody hears your Health Freedom Minute, and it is giving a lot of vital information to the citizens here and all around about what's happening in America, what's happening in the political realm. But could you start by just sharing your own personal journey and how you got involved in this?
Okay, well, that would be a rather long story, so I'll just make it short. When the Clintons decided to take over healthcare, that was when I felt God telling me to start an organization to stop the nationalization of healthcare in America. And so I've been doing this for 30 years, and the organization that I run is the second one. We had a precursor organization. This is the second one, and this second one has been running for 27 years. And really, this was all about patient and doctor freedom, protecting the right of patients and doctors to work together for the benefit of the patient, confidentially, affordably, and without outside interference, the way medicine is supposed to be practiced. And I'm a registered nurse. I'm a public health nurse as well. And I was really called out of the school nursing environment to start this organization, 3 decades ago, essentially.
Now, the phrase health freedom, what does that mean to you?
So it does mean different things to different people, but really I think it is, as I said, the right of the patient and the doctor to work together for the benefit of the patient. And what that means from the doctor's perspective is to take their brain, their mind, all their critical thinking, and all of their skills and pull them together in a mission-oriented view of the patient to give the patient what the patient needs. From the patient's perspective, it means that you can trust the doctor's going to do the best for you. And so in freedom, you should have the right to pick a doctor who works for you, who's best for you. If you don't have freedom, you're just given whatever doctors are available.
So rather than the government dictating to you who you should go to, like the British system or even the Irish system, and I know that system because I've been there. Even in Belgium, it's a completely different thing. The individual has that freedom. Am I getting that right, Twila?
Yes, that's correct. So one of the things that we do is we try to make sure that all the different ways that we could get to socialized medicine in this country are not achieved. And so we oppose socialized medicine. We oppose the government version of it. We oppose the corporate version of it. So the health plan that everyone has today is really the corporate version of socialized medicine put in place by the government. People call them private health plans. They're not private at all. They're very much favored by the government, and that's why they control everything.
Now, the Trump administration has making a push for making America healthy again with RFK. Can you speak to that just a little bit, and what do you think about it?
Well, I can understand where RFK is coming from with the additives in the foods. I mean, just look at the package. Just look at the package of any of the processed foods that you buy and see everything that's in there. Even cream. I looked at cream recently, and it's like cream is not just cream. Cream has this carrageenan in it to keep it from emulsifying or keep it emulsified. And so, I understand that. And I understand it from the vaccine perspective. I understand it from the weather, the idea that they would change our weather to make us more healthy. The whole thing about climate change, they want to say climate change and healthcare is the same. Well, is affected by together. And so therefore we should control healthcare and control the climate. And so all of these are agendas in the healthcare sphere. And the MAHA movement doesn't have as much to do with Medicare, Medicaid, insurance, the patient and the doctor all working together. It has to do with these other things outside our body, or things that they want to inject or have us imbibe or intake into our body.
Exactly. It's interesting. When I came here from Europe, I lived in Europe for a while. The first time I had Wonder Bread, I thought to myself, it's a wonder it's called bread because it squeaked, and it's so important. Now, you're a Christian, you're a believer. How important it is for Christians to know about this. Why is that important, Twila?
Well, Christians, it's because of Christ that we are free. And so Christian freedom is essentially a birthright. If you look at the Declaration of Independence, right, this is about the Creator and the system that the Creator set up, which was about freedom. It was not about outside control. And it was not about government control. It was about the Creator's control of the world and of the best thing to do for the people who are in the world, and controlling them and imposing your agendas on them. That is not about freedom. That is not about God. That's about somebody else's, desire to do whatever they want with you for their own purposes.
Yeah, self-determination is a big American idea, right? And also the freedom to worship God, and they both go hand in hand. So how did your Christian faith influence you, or the Bible influence you in starting your organization and where you are today?
Well, the fact of the matter is that God led me to, I've been a Christian for a long time, but Focus on the Family had a citizen magazine, and then there was the Family Research Council in Washington, D.C., and about 2 years before Clinton came into office, I was already reading publications and hearing what his plan was for health care. And then I listened and took notes in September 1993 when he stood in front of the Americans in nationwide television and talked about his plan for health care for all of us, gave us his national health security card, waved it in the air, and I said, if they take over health care, they'll take over the country. And I felt like God was telling me to start an organization out of nothing. I was a school nurse. I once said to myself, I am a no-name nurse from nowhere who knows no one. How is this going to work out? And God said, basically, trust me, move forward.
It's like Gideon's army, right? That's how you probably felt, I can imagine. Now, freedom is a big issue. Freedom in our health, knowing what we're eating, knowing how we should get our health care, all of that kind of stuff. There's other aspects of the government that they want to impose upon us. And I know we talked earlier about the Real ID. Tell us a little bit about that.
It's so important for people to understand that now, because all the media and even the government officials are talking about this wrongly. They are saying that on May 7th, you have to have Real ID or you will not be able to fly. And for Kristi Noem, Secretary Kristi Noem of the Department of Homeland Security, to actually put this in a video and say this as though it were true is really a terrible disservice to the American people, because the rule that got put out by TSA and her own department, the Department of Homeland Security, says that there is a 2-year progressive enforcement period. It warns against essentially putting the hammer down on May 7th and mandating it. It talks about the disruption, the chaos, the backlash against security agents that will happen. And yet she came out and in a video and said, if you don't have Real ID by May 7th, you won't be able to fly. Not only that, but there are 16 different identification cards, including a passport card, military ID, a VA ID, where you can fly. You don't have to have the Real ID. And then to add on to all of that is the fact that the Real ID is unconstitutional. It's not just a driver's license. It's a national ID system. It's the federal takeover of the states and the individual's sovereignty. And so what we have here is a real violation of our rights as Americans, and therefore we have a special site, refuserealid.org, refuserealid.org, where you can find some of our documents, like how to switch back to a state driver's license if you find that you have the star on your card. The star means you have a Real ID. You're part of this national system of surveillance and control. And if people are wondering, how is that possible? Well, the plan is the DMVs across the country, they plan to digitize the Real ID, put it on your phone, and have remote access to it. And so what we're really talking about here is paving the way to a social credit system in this country called America, and that would not be freedom at all. So that's
just
why,
like the Chinese have.
Exactly right. So we are leading this charge across the country. We are putting up billboards supported by our donors. Texas, and the next one is going up in Kentucky, and another one will be going up in Florida. And so everybody needs to be aware of what this card really is, what the plans for it really are, that it's not a driver's license, that it's a usurpation of states' rights. And in fact, in the very beginning, 37 states wrote laws back in 2008, 2009, saying we are not going to comply, but because this is a usurpation of states' rights and a violation of individual rights. And it was only when Obama came out and said falsely, you can't fly, that people started to panic, called their legislators, and state legislatures at that time started to fold, right? But the fact of the matter is we must stop the real ID. And here in Minnesota, our organization stopped the digital ID just a few weeks ago. And so everybody must refuse the real ID and must refuse the digital ID and see where the net is, because this is a net that's closing around, and it's up to we, the people, to stop the net from finally closing and
I could
shutting off.
imagine how if the government has its way with the real ID and then a digital coin, before you know it, they control everything. And they're trying to control everything. I come from socialist Europe. And the one thing that a lot of socialist Europe does not understand is the law that America has for freedom, individual freedom. And if we lose that, of course, it's going to be detrimental, not only for us, but the next generation will wake up in a world and they have never known individual freedom. It is tremendously important to understand it. Now, where do you see the future of healthcare in America going in the last couple of minutes here, Twila?
So I believe that we are at a tipping point one way or the other, and I have a lot of hope for freedom in the country, but there's going to be a lot of upheaval in the meantime. But our plan, we have the Wedge of Health Freedom at jointhewedge.com, and this is a place to find cash-based doctors. The entire system must move back to cash and then real and true insurance, only for catastrophic and insurable events. That will bring all the prices down. That'll bring full transparency, full confidentiality, full attention of the doctor on the patient, no third-party interference. We will have cash-based hospitals in our future. But if you were to talk to the main people around, they'll say that'll never happen. But our organization plans to make that happen. Real insurance and cash will bring healthcare back to the affordability that we all cannot even believe today is possible, but is truly possible.
Truly possible. Now, what is your main website, Twila, that people can get in touch with you and your organization?
They can go to cchfreedom.org, cchfreedom.org.
And you do the Health Freedom Minute here on the stations here at Salem Media, and we enjoyed them tremendously. What's the one thing that you would encourage people with as they're thinking about all this? There's a lot coming our way, right? We're kind of getting bombarded. What's the one thing that you would say to people to encourage them and take the right steps?
Well, right now it's a matter of, are you going to be free or not? Because of, will they control what you can and cannot buy, where you can and cannot go, all because of a digital national ID? So I would encourage them to go to refuserealid.org and take the steps that we have there. Turn in your real ID and get a state driver's license and share information everywhere. Thank you.
Fantastic. Twila, we really appreciate you coming on the program. We thank you for all your efforts to keep us informed of what's happening around the country and here in the state of Minnesota. You are listening to Ministry Connections on AM 980, The Mission, where we give you a better look at ministries and churches here in the Twin Cities. You can find us also on YouTube and Facebook. Just look for AM 980, The Mission. My guest today was Twila Brase. Yeah, give it to me again, Twila.
Citizens Council for Health Freedom.
Oh, my goodness. Citizens Council for Health Freedom. Thank you, Twila, and God bless you.